Hello, my name is Dana Hammer, and I'm doing my presentation on gastroesophageal reflux disorder, also known as Gerd. My presentation could look a little confusing as I did set up my presentation in a brochure type setup. So the middle panel that goes over gastroesophageal reflux disorder, that would be the front of the brochure. As you open the brochure, you'll look to the far right. The three columns would be the inside of the brochure. And then to the far left, you'll have the inside flap of the brochure. And in the middle of the left side, you will have the back of the brochure. So what is GERD? GERD is a chronic condition where stomach acid flows backwards into the esophagus. Instead of staying in the stomach where it belongs, the acid moves upward, irritating the esophageal lining. A helpful way to think of GERD is that it's a mechanical problem. The valve that's supposed to keep stomach acid down simply is just not doing its job. GERD is a very common, and it's affecting about 20% of adults and even 10% of children in the United States. So signs and symptoms to look for. Symptoms can vary, but most common symptoms include regurgitation of food or sour liquid into the throat, burning in the chest or stomach, especially after eating, non-cardiac chest pain. So some people might experience chest pain. You want to rule out any kind of cardiac issues if somebody is experiencing chest pain, obviously. But some people might not have the burning sensation. They might have just generalized chest pain. So after ruling out any cardiac issues, you'll want to then go on with the possible diagnosis of GERD by looking at things like nausea from acid overflow, sore throat caused by acid irritation, and then also asthma-like symptoms, especially at night, due to acid reaching the airway. These symptoms can significantly impact daily comfort, sleep, and overall quality of life. Babies can even have symptoms of GERD. So GERD can also occur in infants, though it often looks a little different than it does in adults. Common symptoms in babies include persistent bad breath, excessive fussiness, difficulty sleeping, refusing to feed, small but frequent episodes of vomiting, and also wheezing or hoarseness. Because babies can't verbalize discomfort, recognizing these signs are very important. So some red flags that you'll want to look for GERD. While GERD is often manageable, there are certain red flag symptoms that require immediate evaluation. These include gastrointestinal bleeding, anemia, painful swallowing, unintentional weight loss, early satiety, age over 55 with new symptoms, recurrent vomiting, and a palpable epigastric mass. These findings may suggest something more serious, such as malignancy or severe inflammation, and should never be ignored. Differential diagnoses. So many conditions can mimic GERD, so it's important to rule out other causes such as gallstones, peptic ulcer disease, gastritis, angina, esophageal motility disorders, and gastrointestinal malignancies. This is why accurate diagnosis is essential. Not all chest or stomach discomfort is caused by acid reflux. So diagnosing. Several tests can be used to officially diagnose GERD. Upper endoscopy. A camera is used to look directly into the esophagus and stomach for damage or abnormalities. Esophageal pH testing measures how much acid is coming up into the esophagus. Esophageal manometry measures the strength and coordination of esophageal muscles. And then an esophagram, a barium swallow X-ray that shows how the esophagus moves. These tools help determine the severity of reflux and guide your treatment. Some examination findings that you might see. So during a physical exam, providers may look for dental erosion or worn enamel from chronic acid exposure, halitosis, also known as bad breath, epigastric tenderness, wheezing or coughing, or signs of weight loss or nutritional impact. In severe cases, stool may be tested for blood if erosion or ulcers are suspected. So some treatment options that you may have. Treatment focuses on both lifestyle changes and modifications. So lifestyle changes, these are often the first step, and they include avoiding trigger foods, reducing alcohol and tobacco use, eating smaller, more frequent meals, avoid lying down after eating, and losing weight if needed. Some medications that you may try to use, depending on severity, providers may recommend antacids for quick relief, H2 blockers, PPIs, the most effective at reducing acid production, and also baclofen, in some cases to reduce reflux episodes. The goal is to reduce acid exposure and allow the esophagus to heal. Understanding its signs and symptoms and diagnosis and treatment options empowers patients and families to seek help early and improve outcomes. With appropriate management, whether through lifestyle modifications, medications, or diagnostic evaluation, most people can find relief and prevent complications. Thank you for listening to my presentation.